Welcome to this edition of the RSNA Radiographics Podcast. I'm Dr. Erica Lanser, Assistant Professor of Radiology and the Musculoskeletal Radiology Fellowship Director at the Medical College of Wisconsin in Milwaukee, Wisconsin. In today's episode, I will review two recent education articles from Radiographics. The first article is titled, "The New American Board of Radiology Certifying Oral Examination. How Should Diagnostic Radiology Graduate Medical Education Evolve?" by Drs. Mocarala, Bentley, Gomez, Jayao, and Zaki Mateus, published in the June 2024 issue of Radiographics. This article reviews the current format of the qualifying and certifying exams, provides historical context to how we got to today's exam structure, and discusses the transition to a new oral certifying exam format, which will begin with the class of 2027. This transition will necessitate a shift from our current educational and board preparation paradigm. The authors provide potential solutions to prepping residents for the new exam format. In 2023, the American Board of Radiology, the ABR, announced that they have elected to return to an oral exam format for the certifying exam. The first administration of this exam will be in 2028. Current second-year residents, the class of 2027, will be the first cohort to take the new exam. In the late 2000s and early 2010s, the current computer-based multiple choice exam replaced the original oral exam format. There were many reasons for the transition away from the oral certifying exam. Since the end of the original oral exam format, radiologists have regaled residents with stories of their experiences with the oral certifying exam, the good, the bad, and everything in between. However memorable and entertaining these stories may be, the required trip to Louisville, Kentucky in the final year of diagnostic radiology residency was time-consuming, costly, and stressful for both residents and examiners alike. Taking the exam in the final year of residency shifted the focus from clinical work and viewbox learning to exam preparation. As subspecialization increased, it was felt that a multiple choice exam could better reflect modern day practice. Additionally, moving to a computer-based exam allowed the inclusion of scrolling, window leveling, and anatomic reformatting capabilities. The current certifying exam format was developed, consisting of 4 modules: 1 Essentials of Diagnostic Radiology module, plus 3 clinical practice modules in subspecialties selected by the candidate. The current exam was moved from the final year of residency to 15 months after completion of residency and 3 months after fellowship. However, there was growing concern that in its current format, the multiple choice certifying exam might not effectively evaluate critical competencies, such as synthesizing differential diagnoses and communicating these effectively with colleagues. Additionally, with the rise of artificial intelligence and recent studies demonstrating ChatGPT's ability to pass the core exam, with particularly good performance on non-image-based lower order and clinical management questions, the landscape of evaluating competency is changing. Furthermore, there was concern that the current exam structure does not place enough emphasis on higher order abstract thinking. So it seems what's old is new again. Enter the new oral certifying exam. Unlike the oral exam of the past, this exam will be conducted via an online platform. In a change from the current multiple choice certifying exam, candidates will be tested across all radiology subspecialties and modalities. Tested subspecialties will include breast, chest, abdominal, musculoskeletal, nuclear radiology, pediatrics, and neuroradiology. Candidates will meet with one examiner at a time who will administer standardized cases within their specialty. Examiner panels will be balanced by geography, gender, and experience, and they will use defined rubrics for each case. The ABR will provide a study guide and exam material prior to the first administration of the new oral certifying examination. The change in exam format will necessitate a change in graduate medical education curricula to prepare residents for the new oral certifying exam. Currently, board reviews may place an emphasis on multiple choice test-taking strategies and large volume rapid fire cases with little case discussion. The authors of this article propose that preparation for the oral exam would benefit from increasing the quality and quantity of resident case conferences and hot seat conferences. In hot seat conferences, residents are put on the spot to take a case, describe the findings, form a differential diagnosis, and describe the next steps in management. Mastering the art of taking cases requires practice and can only be achieved through continuous and early exposure to the process. Early involvement in tumor boards and multidisciplinary conferences are great opportunities for case discussion with other healthcare professionals, including imaging findings and treatment plans, and can reinforce real-world application of case-taking skills. Residency mock oral examinations may be another beneficial tool to give residents the opportunity to practice an oral examination before test day. Other countries, including Australia, the United Kingdom, Canada, and many European countries, already require an oral exam as part of their radiology certification process. It may be beneficial to look to the experiences of international colleagues in preparing for their oral examinations to guide curriculum development. For example, Canada has a standardized review course with a mock oral exam component, including one-on-one feedback. A similar process may benefit trainees preparing for the new ABR certification process. In addition to the change in format, the timing of the certifying exam will change. The new oral exam will be completed in the calendar year following residency. This means preparation for the exam will coincide with subspecialty fellowship training. As a result, fellowship directors may want to incorporate general radiology case conferences for their fellows. As the ABR transitions to the new oral certifying exam, diagnostic radiology residency programs and trainees must familiarize themselves with the new exam and adapt their curricula for success. Thank you to the authors of this wonderful article, Dr. Mogarala and colleagues. I hope you find this article review on the upcoming changes to the ABR certifying exam helpful as we transition to the new oral certifying exam. The second article I will review is titled How to Succeed as a Radiology Fellow by Dr. Zhang Gulati, Payas Carpio, Zaki Matias, and Cladera from the May 2024 issue of Radiographics. This article provides radiology residents a roadmap for success as they transition from residency to fellowship. While the structure, approach, and teaching philosophies will vary across fellowship programs, there are certain principles which are generalizable across fellowships. As a fellowship director myself, this topic is near and dear to my heart. The first attribute, self-directed learning, will set you up for not only a successful fellowship, but a successful career after the completion of your training. The practice of medicine, and specifically radiology, requires lifelong learning. Establishing the skill of self-directed learning in fellowship will help you throughout your career. To be successful at self-directed learning, you must set goals, track progress, utilize available resources, and seek feedback. As residents transition to fellowship, they should establish goals that are focused on the type of practice they plan to join following training. Additionally, fellows should realistically assess deficiencies in diagnostic and/or procedural skills and actively seek advice and resources to address deficiencies and achieve goals. Throughout the fellowship year, fellows should remain engaged and inquisitive, continually seeking to improve their knowledge through a combination of self-directed reading, attending subspecialty-specific lectures and instructional courses, and educational materials provided by subspecialty societies. Fellows should take advantage of multidisciplinary tumor boards to tailor their reporting to maximize value to referring clinicians. Maintaining interesting case logs, following up on interesting and complex cases, and staying abreast of new developments in your chosen specialty will help build a successful career after fellowship. There are several more attributes that successful fellows demonstrate. These include attention to detail, efficiency, reliability, and integrity. Attention to detail may include reviewing clinical indications, chief complaint, relevant medical history, and pertinent physical exam findings and laboratory results. Fellows need to develop strong time management skills to manage busy clinical services and complete tasks efficiently and accurately. Fellows should strive for autonomy commensurate with their level of training. However, fellows must recognize their limitations and know when to seek help to provide the best patient care possible. Perhaps an overlooked aspect of fellowship is building relationships and networking. Co-fellows within the same subspecialty can be valuable resources and support as you transition to independent practice. Fellowship provides the chance to be both mentee and mentor. Especially if you plan to pursue a career in academics, take the opportunity to mentor a resident. Additionally, you may want to take the opportunity to get involved in subspecialty societies and connect with mentors outside of your institution. Fellowship also provides the opportunity to build skills necessary for successful scholarly activity after training is complete. While most fellowships are just 1 year, which may limit the scope of projects that can be completed, it is important to develop these skills as a fellow to set up future success. Keeping in mind your future career goals, scholarly activity can take many forms. Clinical research, review articles, and educational exhibits may be more relevant to future academic careers, while informatics or quality improvement projects may be more appropriate for fellowships interested in private practice careers. While fellowship can be a demanding and stressful time, it is also an exciting transition from trainee to independent practice. Developing or strengthening good wellness habits that will serve you in your career after fellowship is also an important role of this year. Seek opportunities to socialize, building strong social support systems both within and outside of work. Strengthen your mental well-being through mindfulness, journaling, or other stress-relieving activities. And maintain physical health through healthy diet, exercise, and good sleep habits. These things can be difficult, but are essential to safeguarding well-being. Thank you to the authors of this wonderful article, Dr. Zhang and colleagues. I hope this review will help you be a successful radiology fellow or help you mentor residents as they transition to fellowship. Thank you. You can help grow the Radiographics podcast audience by rating, reviewing, and subscribing. Be sure to check out these 2 articles and the rest of the amazing radiographics content on the website. Thank you.